Prescription for Addiction, a Failed Experiment, your second psychiatric consultation. Today we're going to talk about meprobamate, the first major hit for the pharmaceutical industry that set the algorithm for the pharmaceutical industry after 1950. In 1950, meprobamate was synthesized, and in 1955 it was marketed as Miltown. In 1956, 1 in 20 Americans had used Miltown. By 1957, Miltown was 1/3 of the prescriptions written in the United States. Valium was approved by the FDA for treatment of anxiety. Valium and other benzodiazepines replaced Miltown. When I was a medical student in 1970, I was assigned to a surgery rotation with other medical students at Detroit General Hospital. During the surgery rotation, we made rounds on the burn unit. At that time, if a patient had 60 or 70% third-degree burns over his entire body, he was expected to die. However, surgeons were afraid to give high doses of opiates for pain because of the fear of increasing the death rate. There was a young man with a 70% third-degree burns over his entire body. Every day when we made rounds, he begged for pain medication. "Please give me pain medication." The surgeons explained, "The pain medications might kill you." The patient answered, "I don't care if I die. It is so painful. Please give me pain medications." The surgeons and medical students left the patient while he continued to beg for the pain medications. The medical students talked about how much pain the patient was in and how hard it was to deny his pleading for pain medication. It is hard to deny pain medication when a patient begs. He did not care if it increased the risk of death. He still begged for pain medication. He died after about 5 or 6 days. I have never encountered greater suffering. Now pain medications are not withheld in burn units. When I was at Henry Ford Hospital from 1975 to 1977, I consulted with medical surgical units. A number of my patients had terminal cancer, and I would order Brompton's mixture for relief from pain. This, in large part, was due to my experience on the burn unit at Detroit General Hospital in 1970. I would order morphine for pain, cocaine for pain, Thorazine for pain and anxiety, Elavil for depression, and methamphetamine so that the patient would not be sleeping all the time and could say farewell to friends and relatives. The pharmacist called and asked me to stop ordering Brompton's mixture. "Dr. Yee, could you please stop ordering Brompton's mixture?" I asked. "Why not?" He answered, "Because we can't keep it." I said, "Well, just lock it up." He replied, "We do." I understood the problem, but I felt my duty to the patient was greater than my duty to the hospital, and I kept ordering Brompton's mixture for the terminally ill cancer patients. There weren't many, and sometimes they died in the hospital before I was able to do the consult on subsequent admissions. Recently, I consulted at a hospital in Kentucky, and I told the nursing staff that I ordered Brompton's mixture for terminally ill patients. They did not know what it was, so I told them to call the pharmacist. They called the pharmacist, and he told them that it was not in the formulary. The formulary is a list of medications that are made available for treating patients. Non-formulary medications may be requested. Requests for non-formulary medications are usually denied. I believe that if I ordered Brompton's mixture for terminally ill cancer patients, my order would be denied. If I made a non-formulary request for Brompton's mixture, I believe that the request would be denied. I looked it up on the internet, and there is literature that states that Brompton's mixture is obsolete. I don't see any better treatment replacing it. It would mean that the terminally ill suffer needlessly, like on the burn unit in 1970. That is one man's opinion. I don't know if being outnumbered means that I am wrong. I know that being outnumbered means that I may be right and lose. How often is your doctor right but loses to the insurance company, hospital, or other third party in pain, not in pain? I will accept the findings of a literature review meta-analysis or Cochrane review. Maybe one should be done. From 1975 to 1977, I found that many of my psychiatric patients were addicted. I reviewed the medical literature on treatment of drug and alcohol addiction. I will discuss that issue tomorrow, starting at page 10 of this book. Thank you for your time and your kindness. Have a great day.